Hi, my name is Jamie Marie Lagman. This is going to be my trait care video for BSN 266. I'm in section 2. I'm in the proper Nightingale attire, my scrubs, and then I also have my Nightingale badge on. Before I start, I'm going to go over all of the supplies. So first is the tracheostomy clean and care tray. Because I have been practicing, the kit has already been opened, but in real life, you obviously would want a completely unopened brand new kit. Clean gloves, hand sanitizer. I don't have a bottle of normal saline, so this will have to act as my normal saline. Some tape, which I've already pre-cut some tape. A trash can as well. So before I walk into my patient's room, I'm gonna verify the provider's orders. I'm gonna make sure that there is a active order for me to perform trach care for this patient. And once I have done so, I'm gonna walk into my patient's room. Knock, knock. I'm gonna close the door behind me, close the curtain, provide privacy, and perform hand hygiene. Introduce myself. Hi, my name is Jamie. I'm gonna be your student nurse for today. It looks like the provider has ordered for you to get some trach care done. Did you have any questions or concerns? No? Okay. Before I begin, can I just get your name and your date of birth? Perfect. They were able to correctly identify their name and their date of birth, and I was able to verify that information with their wristband. And I'm just going to provide some education as to what I'm going to be doing. So, like I said, I'm going to be doing some trach care, so I'm going to replace the gauze around your stoma. I'm going to be cleaning around it, and I'm also going to be replacing the neckties. This procedure might be a little bit uncomfortable, so if at any point you need to take a break and you want me to stop, just raise your hand, and that can signal me to stop, and we can take a break from there. Did you have any questions, concerns? No? Okay, perfect. Now I'm just gonna raise the bed to a appropriate working height level, and I'm gonna adjust the head of the bed. So I'm gonna have it at 30 degrees unless it is contraindicated, but in this case it's not. So 30 degrees, and now I'm gonna assess the cardiopulmonary, the vital signs. Now that all of that looks good, at this time I'm going to place a pulse oximeter onto one of your fingers. This pulse oximeter is going to have to stay on your finger throughout the entire portion of this procedure, just so that we can continue to assess you and assess your oxygen levels as the procedure moves along. Okay, did you have any questions? No. Okay. Now at this time, I'm going to pre-oxygenate my patient for about 30 seconds. I'm going to pre-oxygenate them, also encouraging them to take deep breaths in and deep breaths out. And once I have done that, then I'm going to perform hand hygiene again, like so, and I'm going to put my clean gloves on. And now I'm going to remove the soiled gauze. So now I'm just going to remove your old gauze. Perfect. And now I'm just going to toss my gloves and the soiled gauze into the trash can and perform hand hygiene once again. Once I have performed hand hygiene, now I'm going to open up my tracheostomy clean and care tray, and I'm going to open this away from me, like so. Now I'm going to take there's a drape in here, so I'm going to take it, making sure I only hold the shiny side, and I'm just going to drape this over the patient like so. I also have some sterile gloves, which I will place to the side as well. And then now I'm gonna dump all of the contents in the kit on top of the sterile site. Once that is out, now I'm gonna take my normal saline and I'm just gonna dump this into the tray. So I'm gonna pour into all 3 sites. Perfect. And now I'm gonna put on my sterile gloves. So I'm gonna move this over here. Obviously in real life it would not be like this, but I'm gonna open up my sterile gloves. I'm gonna make sure I pull everything away from me and making sure that I only hold on to the border, the 1-inch border around. And once it's fully open, I'm gonna make sure that I completely flatten it so that it doesn't fold over onto like our sterile gloves. So once I have it opened, I'm gonna first start with this side and I'm just gonna pinch it where it is not sterile, and I'm just gonna slip my hand inside, making sure I don't touch any of the sterile parts, like so. And now I'm gonna move on to the other side and I'm gonna grab it, but I'm gonna go under the cuff. So. Once I have my gloves on, I'm gonna make sure that my hands stay above my waist the entire time that I am performing trach care. And now we're gonna move on to actually performing the trach. For this video purposes, I'm gonna have to move the camera so that you are able to see what I'm doing, but obviously in real life I would not be touching anything with my sterile gloves, but I need to have you guys have a better look at what I am doing. Okay, so once I have my sterile gloves on, I'm gonna rearrange all of my supplies to how I need them to be. So just gonna rearrange all of this so it's nice and organized. My gauze. And I'm gonna place all of my Q-tips onto my cleaning solution, like so. Once I have that all placed, now I'm gonna remove the inner cannula and I'm gonna place that into the cleaning solution as well. So I'm gonna take it and I'm gonna pull it out along with the curvature of the cannula, and then I'm gonna drop it into the normal saline. Now I'm gonna clean the cannula with this, cleaning it. like so. Then I'm going to drop it again into more of the cleaning solution. I'm going to toss the brush. Now I'm going to remove the cannula and I'm going to reinsert it, making sure that I go in with the curvature of the cannula and making sure that this is completely dry before I put it in as well. So I'm going to put it in, making sure it's locked, it's good. And now I'm going to be cleaning the cannula, or I'm not the cannula, I'm sorry, the stoma around the trach. So I'm going to take a Q-tip and I'm just going to clean above it. Toss it, clean underneath it, toss it, clean it again, toss it, and then one more time, I'm gonna clean around. Perfect. Once I have cleaned all of it, now I'm gonna pat dry it with a piece of gauze. So I'm gonna take the gauze and I'm just gonna go gently around it, cleaning it like so, and then I'm gonna toss it. And now I'm gonna place a new split gauze where his stoma is at. So once a new split gauze has been placed, now this is the time where I'm gonna change the neckties. When changing the neckties, you want to make sure that in real life that there is two people so that one person can assist you by holding the actual trach in place. But for the video, it's only going to be me, so I'm just going to be holding the trach on my own. And I'm just going to undo this person's trach ties. Making sure I also just hold it in place because it can fall out of place. This is why you want a two-person assist. So we're going to take out the old ties like so, and we're going to place the completely brand new ties. So what it looks like. So I'm going to loop it around one side. Like so. And then when I'm looping it around, I'm going to try to make sure that the tie remains completely flat, because we want to maintain the skin integrity of the patient. So we want to make sure it's completely flat at all times. we're gonna just tie it off in the back. Like so. And you want to make sure that when you are tying it, it's not like completely it's not too tight, because then you would be possibly choking the patient if it's just on too tight. These ties are a little bit different than the ones that were initially on, so I'm having a little bit of difficulty tying it. Okay, once I have the neckties on, then I want to be able to make sure that I can fit 2 to 3 fingers underneath the trach ties. So I can fit 2, and then I also can fit 3. I can do this on both sides. I'm not sure you can see. On both sides I can do it. And then because we did tie a knot on the back side, we can place a piece of gauze back here to kind of cover the knot, so that the knot isn't directly like on the patient's skin, because again, you want to maintain the skin integrity of their skin. That is the most important part when it comes to these trach ties, is maintaining skin integrity. And then we can just seal it off with a piece of tape. That's what the tape is for. Okay, perfect. And once that is all placed, then we are all good. We can just do a quick check-in with the patient. How are you doing? Doing okay? Yes? Okay, and now since we're all done, we can just take everything and throw it in the trash. Take our gloves off. Perform hand hygiene again. And now the complete trach care is completely finished. I'm gonna lower their bed to the lowest position possible, making sure that the call light is within reach. And just do another check-in with the patient. All right, you are all finished with your trach care. Are you feeling okay at all? Any discomfort or anything? No? Okay, checking his O2 levels. O2 levels look good. This is the time when I remove it. And now I'm just gonna take all of my trash and perform hand hygiene, take my trash, and walk out the door. And this is the time when I would document. I would document how the patient tolerated it, how they tolerated the procedure, if there was any kind of drainage on the soiled one in the beginning, and I would just also document if they were if they're having any discomfort or pain. And that concludes my trach care video for BSN 266. Thank you so much.